My name is Dr. Shannon O'Neill. I am a licensed psychologist and an assistant professor of the psychiatry department at Mount Sinai West. Great question. So agoraphobia is a clinical diagnosis under the umbrella of anxiety. This entails marked fear or anxiety across a number of situations. So whether that be going outside of the home alone, using public transportation, standing in line, being in large crowds or enclosed spaces. Within these scenarios, there are often thoughts that escape may be difficult, and so naturally this can escalate with concerns of the virus. When there is fear of leaving the home, significant avoidance or behavioral modifications can start to develop. This could be turning down invitations, starting to self-medicate before leaving the home, or even engaging in safety behaviors, such as leaving the home with just a trusted loved one. It makes a lot of sense that people are feeling anxious and unsettled right now, just when we are finally adjusting to a new normal with some predictability and flow. The world is preparing to change all over again. So future uncertainty and a sense of not knowing what to expect can really start to fuel anticipatory anxiety. Similar to adjusting to social distancing or in quarantining at home, there will likely be a significant readjustment period of phasing normalcy back into our life. So in fact, there's actually even a diagnosis known as adjustment disorder, and this often entails emotional or behavioral reactions to a stressful event or change in a person's life. This can cause natural symptoms of depression as well as anxiety. Yes, and in most circumstances, absolutely. So beginning to reintegrate routine outside of the home in incremental doses can enhance one's confidence. Having that extra protection of the vaccine amongst ourselves and within our community will offer added physical and emotional security to phase in that normalcy that we desperately want. If current behaviors or emotions cause significant distress or are starting to impact daily functioning or other just interpersonal relationships, this would be a good time to seek help from a trusted provider. Also, if being self-medicated is necessary, let's say to white knuckle your way through a task or seeking help would be important at that time. So telehealth services rapidly expanded within the Mount Sinai system at the start of the pandemic, and this can be a wonderful way to begin psychotherapy for those with anxiety or agoraphobia. Working towards even just meeting in person with your provider is a great treatment goal at the start of sessions. A classic treatment approach for any anxiety diagnosis is exposure. Rather than avoiding what is feared, it is important to really lean into the activities that you were once fearful of. So technology has been very helpful and a wonderful incentive for us to stay home when it was important to do so, whether that be grocery or pharmacy delivery, virtual happy hours. However, this can quickly turn into over-accommodation and avoidance naturally follows. So with repetition of repeated exposures to the feared stimuli, of course, while also following CDC guidelines, your body will eventually habituate, or in other words, become more comfortable with the trigger itself. So this may mean socially easing in with smaller commitments and with time limits before expanding out to bigger outings. Also, another good rule of thumb, knowing your boundaries and limits ahead of time. This allows for some predictability and certainty. So identifying what is in your control and reducing those stressors. We do know that we are in control of our behavior, which can, of course, influence our thoughts and our emotions. So ask yourself, what are you willing to tolerate? Is it the group size, the rules around mask wearing, the amount of time you're present? And then stick to that plan. That can offer a really good sense of confidence in your action plan before even leaving the home.